And before we move on to your role after your MPH as a senior public health fellow at AI for Good Foundation, were there any takeaways about your MPH and I guess about your Masters of Science in Molecular Medicine that you wanted to share with us?
The main takeaway was for me was how to, keep on be in the process of keep on the learning mode on. You never know where your journey is taking. You just have to be open to learn, and learn, and be a be a person who can be molded and adjusted into any circumstances. So you don't know what kind of a curveball you're going to be thrown at, and just be resilient because at the end you come out as a stronger person. Yeah. So this was the most important takeaway because when I started my journey as a student in US, the worst, and when I compare my journey as a student in India, they are absolutely strikingly different because different education system, different education strategies, and and it was not that tough because I was closer to my family. It was not tough because I was in the country where I was born. I knew the rules of living there. So I was discovering the rules to live in US, being an immigrant, knowing the culture over here, and knowing how the education system works over here, how to go and talk to a bursar, how to get a scholarship, where to find a scholarship, how to maintain a scholarship in good standing, how to find an opportunity, and how to uh, how to make a direction through what you have a goal and a destination eventually. So yeah, that it has been a really great journey overall.
Seems like a great learning experience and great experiences that you've had over the time. And then you graduated from your Masters of Public Health. You became a senior public health fellow at AI for Good Foundation. Tell us about that role.
So my I thought that I had a great dynamic experience with public health during my program, and I would be killing the professional like real time of action. But unfortunately, COVID-19 also changed a lot of things in the professional side, how to get a job, and everything. And especially being an immigrant, you are on a timeline, you are on a clock. So you have to get a job within your OPT time when and stop the clock and get sponsorship from your employer. So this panned out and increased a level of difficulty in getting job to me. So this opportunity at AI for Good was an opportunity which came in dire need for a job because I was being interviewed. It's not that I was not being interviewed. I got an interview from CDC Foundation. I cracked small interviews with a lot of other organizations as well, but nothing was working out. So one of my friend told me that if while talking she saw that I'm on clock, my clock is going to end soon. So she helped me out and connected me with the CEO of AI for Good Foundation. We talked about, and he told me about his new innovative idea of combining AI with public health projects or community health projects to better the access of healthcare services in the community. And I think everything aligned over there, and it also opened up my world for knowing AI better and inquisitiveness of uh, incorporating AI and help data. So this, so basically, I was initially doing just the research work, but unfortunately, during that time, I had to, my clock ended and I had to find another job. So could not produce, um, I could not produce the results with AI for Good of Foundation, and I had to move on. But I surely got a lot of skills by doing the research, the foundational work for the project, and working with the CEO. So that was a plus and a takeaway from that fellowship. This led me to an opportunity which was presented to me when I was just surfing LinkedIn, and I came across this announcement saying call for all the consultants. I was like, wow, what is this? Public health consultant. I read the job description that actually matched my profile, and it was actually a very close inclination to my substance use experience. And I emailed and I was enthusiastic, and I emailed my resume, and soon I received a discovery call invitation from Jacqueline and Dr. Amaka Onukaga, the founder and CEO of Amaka Consulting and Services, Evaluation Services. And since then, I was included in their pool of repository independent senior public health consultant. And yeah, I am constantly in their touch and presented with lots of opportunities of working with them. And that actually led me on to my career as a public health consultant. And while still I was searching, at that point of time, I was also searching. This was a part time job, an independent contracting job with Amaka. So I was also searching for a full time opportunity by then. And there was there was very difficult time finding, basically, let me say that I was stuck and confused in that part. There's when I decided, I came across Quisha Memba's profile, and I connected with her. I also started following the journey of Quisha Memba, and then I came up with, I was recommended with a lot of women in the same public health entrepreneurship journey. That's how I came in contact with Dr. Desiree Strickland. And at that time, if I reckon, she did not have any programs for coaching. And so I went to Quisha. She took me under her wing, and she explained me, she mentored me, and introduced me to how public health entrepreneurship works, how to grow, scale, and eventually grow scale in this business. And now I have great coaches who are helping me throughout my journey of self-employment.
Well, that's awesome to hear that a little bit about that journey, as well as those three ladies that you mentioned. Dr. Lydia Maka has been on the podcast, Desiree has been on the podcast, and Kisha has been on the podcast. And I would be sure to link this book, Public Health Entrepreneurship, in the show notes for anyone that's interested in diving more into that.